Hey everybody, Dr. Deom here at Hazleton and Stroudsburg Eye Specialists. Just one of the dedicated eye care professionals that are still here for you. We have Dr. Tom Kislin, the founder and medical director of Hazleton and Stroudsburg Eye Specialists. Dr. Corinne Bellinger, who spends time in both our Hazleton and Stroudsburg office, and Dr. Brian Olzinski in our Stroudsburg office. We also have surgical care from Dr. Frank Bucci and Dr. Sachin Patel. I'm here today outside in the parking lot to show you the big eyeball. I'm just kidding. That's not really why I'm here. Why I'm here is because we are obviously in some really different times. So I'm standing outside here with a really different look. I have a mask on and a face shield, and I want to just show you the new mechanism by which we are inviting patients into our office and the care that we're going to make sure that people are safe in our office and amongst us. So you can see I have a big bottle of alcohol here, and certainly we are equipped with lots of personal protective equipment and hand sanitizer, as well as sanitizer for the office. So let me get prepared and we'll get going and show you how we take care of patients here in the office at our Hazleton office. That's on 281 Airport Road in Hazel Township, Pennsylvania, right here on the Airport Road. You could give us a call at 570-453-2020, and in Stroudsburg, actually in Tannersville, Stroudsburg Eye Specialists, and that's on Route 611, 2943 Route 611 in Tannersville, PA, right behind the Friendlies. So when you come up to the office now in both of our offices, you'll be greeted by our beautiful eyeball. And what's going to happen is you'll park in our big parking lot, lots of space here, and this is your new waiting area. And this is going to be one of the new things that you deal with in lots of different settings, whether it's your eye doctor or your podiatrist, your chiropractor, your primary care doctor. You're going to be probably waiting in the waiting area in your car, and that's to keep socially distant and safe distances from one another. So what you'll do is you'll wait in your car, and as you're in your car, you're going to give us a call. Call us 570-453-2020 in Hazleton or 421-3342 in Stroudsburg. So you give us a call, and after you give us a call, you'll be greeted at the door by one of our staff. So why don't we give it a try? Hello. Yes, I'm here for my eye exam. Can you please get me? Oh, okay, wonderful. You'll want to make sure that you have your face mask on and you're ready to go. Whether you have a medical grade face mask or a N95 or even a homemade cloth mask, anything is going to be better than nothing. So we really prefer that when you come to the office that you're prepared by having your face mask ready and on. Come on and we'll go ahead in. All right. You'll walk into the office as you're greeted by one of our staff that's staying at a safe distance away. Walk up to the desk and you'll be greeted by hand sanitizer. We'd like you to use the hand sanitizer when you come in. Give your hands a good scrub. Let them air dry. After you do that, you'll be told what to do by our lovely receptionist. What should I do? Should I take a seat in the waiting area?
No. Good afternoon. Someone will be right with you to take you directly into the room.
So instead of waiting in the waiting area, like I said, you'll be waiting outside, coming right in the room, and going right to the exam lane, which is obviously much different than maybe what you've known at Hazleton Eye Specialists. Very busy practice. We're proud of providing service to a vast number of patients from all over the geography of the Northeast. Now we're going to take you right in and bring you right to the room. Come on in. So one of our staff will take you right to the room. They'll hand off to the technician, and you'll go right in and start your exam in a really quick, efficient way. All right, guys, so now that you're familiar with our new office flow here in the Hazleton office, again, Hazle Township on the Airport Beltway, you'll see a very similar picture occurring in our Tannersville office at Stroudsburg Eye Specialists. And we appreciate you being patient with us and hanging in there during this very difficult time. One other thing I wanted to just hit on with you, because I think many of you are also being involved with something called telehealth. And so telehealth is a unique mechanism by which we are providing health care to individuals that require it, but from a distance. So we are very lucky that we have technology at both our Hazleton and Tannersville location that provide the ability for us to, either from our home or from the office, to access your records, from the office and be able to do a meaningful interaction with you. So what does that look like? Well, it would require us to call you. We could just call you, or you call us, and we can have an interaction about what's going on with your eyes. We could send you a text message with a link that you would click on, and it would take you to a portal by which you would be able to do a secure, HIPAA-compliant video call with us to allow us to assess the appearance of your eyes and get a little bit more of a assessment of truly how you're doing. And then lastly, we also have the ability to just use some of the things that have always been available to us. That may be FaceTime or Google Duo, or even some of the things that I know many of you are using, like Zoom and GoToWebinar and those types of things. So we will do whatever we can to reach out to you and for you to reach out to us so that we can provide a safe way in which we're able to meet up and see one another. So that's always available to you, and we've been really come light years in as our comfort level with dealing with telehealth has progressed. And I think there are lots of things we could do through telehealth. One of those things is just triaging you, determining whether or not you do need to come into the office, and being able to see you is a very important part of that. And another is just dealing with eye infections, red eyes, irritated eyes, contact lens related issues. Many of those things, dry eyes, can often be handled or started to be handled through a telehealth visit, and many of those are not. Things that would not be able to be done over telehealth would be if you're experiencing flashing lights, floaters or spots in your vision. Certain levels of pain certainly would not be able to be evaluated over the phone. And the eye is a really amazing structure, and we can often learn a lot just by listening to somebody and getting a good detailed history and seeing the outside of the eye. But the tools we have in our office, like the special lamp we use, the microscopes we use, and all the technology we have in our office is really irreplaceable, and part of what makes us really an unparalleled eye care facility. So happy to have those. And on the other side of this break, we're gonna have some fun. We're gonna lighten things up a little bit in the middle of all this craziness and talk a little bit about some eye conditions. So hang on and we'll be right back. Hey everybody, Dr. Deom here at Hazleton Eye Specialists on the Airport Beltway, right down the road from Sheetz and Walmart, right in the middle. We got the big eyeball out front. You don't want to miss it. And you come in Hazleton and our Tannersville office, Stroudsburg Eye Specialists, right behind Friendly's on Route 611. That's 2943 Route 611, Suite 5, Tannersville, PA. Give us a call at either location. Hazleton, it's 570-453-2020. And our Tannersville office, Stroudsburg Eye Specialist, is 570-421-3342. You come into our office, you're going to be greeted in a little bit of a different way. These days, you're going to see us with our masks on. We appreciate you wearing your mask too. But guess what? We are socially distant right now. I'm in your living room, you're on your couch. So guess what? You get to see my face. Isn't that a wonderful thing? And I'm smiling. And so I want to be a joy in your day right now, right here, whatever you're doing. I want to tell you that we love you, we care about you, and we appreciate you. Whatever is going on in your life, I know it's very difficult, but listen, we're going to get through this. We're going to get through it together. And if you do have to come into the office, hopefully we could be a ray of sunshine in your day, provide a little joy in your life. And there's lots of wonderful things around us. And so hopefully this show and the next 5 minutes that we're together will be a little bit of that ray of sunshine. So I wanted to talk to you a little bit about some eye conditions, and I get wonderful feedback from all of you about this show, and I really appreciate that feedback because it helps us know that we're doing a good job. So thank you for all the wonderful feedback. One of the things that I talked to you about recently was our new dry eye treatment device called Intense Pulse Light. We have R2D2, we call her, sitting right over here next to me. And we've had the device for about 5 months now, and I wanted to just give you an update on how we're doing with the IPL device. It's going wonderfully. We've had very, very much success with this device. And so this device is a device by which we use a broad spectrum of visible light. So I have a big light shining on my face right now, and that's visible light. Sunlight has visible light in it. And so that light that comes from the sun, or light that we see that comes from a flashlight, is visible light. And so that light is what comes out of this machine. It comes out of this machine in a very specific way, and we use filters to guide the type of light we want to use. And so I had a sort of a eureka moment recently where I saw this picture, my son looking at a rainbow of light on the floor. And I saw him looking at that, and I saw how he was so, amazed by this. And it really is amazing how light is different. And we don't really think about it. It's just part of what we experience around us. But light rays that we see have different what we call wavelengths. And those wavelengths interact with the world in different ways. One of those ways is that we see them as different colors. But another way that they interact with us is that they penetrate our skin to different levels. And so that's how this device works. We can strengthen and increase the power of the light that's provided to the skin, and we can control the level at which that light goes into the skin. So we can use it to go to a certain level of the skin that affects pigmentation. It would get rid of sunspots and things of that nature. We can use it to go a little bit deeper and affect red spots or blood vessels in the skin. And so that's the power of the machine. But the reason why we use it is to help with dry eye. And the reason for that is that blood vessels in and around the eye and on the face that are leaky, that we can see that are red spots on the eye, leak inflammation into the eyelids. And that inflammation that's leaked into the eyelids causes the glands in the eyelids to produce a poorer secretion. So I have some pictures here that you'll see a before and an after, where you could see the blood vessels actually getting smaller. It's really very, very impressive. And that was after only one treatment. I have a picture here of an eyelid, and you could see how much better that eyelid looks. It's not as red, it's not as swollen. And I could tell you that the patients in both of these pictures showed major improvements in their symptoms and the quality of their tears that were produced. So this new machine that we got here, this IPL machine, has really been a huge success in our practice. And the way that it works is this. So we determine what kind of candidate you are, if you're a candidate for the treatment or not. And the way that we do that is we ask you some questions about your skin, how your skin reacts to light. Does it burn easily? Does it tan easily? What kind of skin do you have? And we grade your skin on a level called a Fitzpatrick score. And that gives us an idea of how your skin reacts to light. So once we do that, we can determine if you're a candidate for the treatment. Then we go ahead and do the treatment. And the treatment is really a quick, easy, simple procedure. It takes about 20 minutes. And we recommend 4 treatments spaced equally by 2 to 3 weeks. And at the conclusion of those 4 weeks, we measure the improvement in the quality of your tears, the volume of your tears, and in your symptoms. And hopefully you're feeling a lot better. One of the interesting things about this is this very broad spectrum of light and this strong spectrum of light and the discussion of light in light of everything that's going on right now. And that is that we're hearing a lot about the way that lights kill certain types of bacteria or even certain types of viruses. I'm in no way making a claim that this does that, but I'm just sort of tying everything together and talking a little bit about what's going on. And so you're hearing a lot about light and the way that light can actually disinfect things. And I think that's a really interesting new topic to think about and to understand. And so certainly strong lights have disinfection qualities, and I think that's a really cool new thing that we have to think about as time goes on here. So I hope you're having a wonderful day. I hope someone told you that they love you today, and if not, I love you, and we're happy that things are going well for you. And if they aren't, I think that probably tomorrow will be a better day. So hang in there and try and focus on something that is good in your life, because sometimes it is hard to do that, but there are many good things in each and every one of our lives. So hang in there, because on the way back, after this little break, we're going to talk a little bit about everybody's favorite thing, neurotrophic keratitis. Talk to you soon. Hey everybody, Dr. Deom here at Hazleton Eye Specialists. We're on Airport Beltway, 281 Airport Beltway, Hazel Township, PA. That's on the outskirts of Hazleton, and we are right here ready for you to help you out and take care of you and your eyeballs. We're also in Stroudsburg, at Stroudsburg Eye Specialists. It's actually in Tannersville, right behind the Friendlies on Route 611, just down the road from the outlets. And we really appreciate you tuning in with us here today, and hopefully this show provides you a little bit of enjoyment in an otherwise difficult time, and hopefully you could giggle a little bit and enjoy yourself for the next couple of minutes. You see this silly thing on my face? It's to protect you from the respiratory molecules that pop out of my big mouth. And so when you're in the office, this is going to be what you're going to see. We're going to have our masks on. We're going to greet you outside, and we're going to walk you in. We'll take you right to an exam room, so you won't be waiting in our big, often busy waiting area. So we're going to be dramatically altering our schedule here, Hazleton and Stroudsburg Eye Specialists, where we're really only going to be having patients come in the office every 30 minutes or so, one patient at a time, into an exam room. So very safe environment. We're going to be taking very serious precautions. You can see I have all my lovely disinfection equipment next to me and my mask. So we're here and we're equipped and we're ready to go. So give us a call, 570-453-2020. That's our Hazel Township office. And in Tannersville at our Stroudsburg office, 570-421-3342. And since you're not within 6 feet, I can take that thing off and I can talk to you and smile, and you can see me smile, and hopefully it makes you smile. And so I told you on the other side of the break that we were going to talk about something called neurotrophic keratitis. What? Neurotrophic keratitis. Yes, this is actually a very, very uncommon condition, or so they say. And why I say that is because I actually think it's something we see very often, but we don't diagnose it. And we don't diagnose it because we didn't have anything that we can use to treat it. And so I'm going to talk a little bit about the cornea. And so the cornea is the front part of the eye. And you can see on the diagram here where the cornea is. It's this clear dome over the front of the eye. And the cornea is very unique because it is the only part of the eye or the only part of the body actually, that has no blood vessel supply to it. It is totally what we call avascular. So it gets all of its nutrients that it needs to survive, all of its oxygen and nutrients that it needs to survive, really from two sources. One is from the oxygen and tears, and two is from the nerves. And so it has these nerves that are embedded in the cornea. And those nerves are very important because they tell us about the tears. They tell us whether or not we have tears. They tell us what kind of tears that we have. They tell us if we have a scratch on the eye. They tell us if wind is coming. They tell us if a bug is flying near us. They tell us to close our eyes, and they tell us to produce mucus to get rid of things that are on our eyes. So those nerves are our defense against the world out there. And if we don't have those nerves, or if those nerves are damaged in some way by a chemical or by severe dryness that's been going on for a long, long time, or even sometimes in a surgery, LASIK can damage some of the nerves in our cornea. If those nerves are damaged, then our cornea does not have any way of telling our body to produce the right kind of tears. So we end up with severe dryness. And we had no way of regrowing or repairing or getting those nerves to be stronger or more robust. And so what happens is something like the picture you see right here, where you see this big green spot on this person's eye. And that big green spot is an ulcer. Now, normally when someone has an ulcer, the person is in severe pain. And they're in severe pain because the nerves that are around that ulcer are sending signals to the brain to say, something is wrong with your eye, goofball, get it checked. And so if somebody has this big spot on their eye and they don't feel anything, then the nerves in their eye are severely damaged. And the problem with that is that not only do they not feel it, and you might think to yourself, well, that's a good thing if they're not in the pain that they would normally be in, and you'd be right. But the problem with that is that they aren't fixing the problem themselves either. So the body is really an amazing thing, and it by and large holds the ability to fix itself in many ways. And with a corneal ulcer, we often can help the body fix itself. But if the nerves aren't there and functioning the way that they should be, then this is something that could stand in the way of that ever getting better. And oftentimes what happens with patients with this thing that we call neurotrophic or damaged nerves, keratitis, and keratitis means inflammation of the eye. So inflammation of the eye from damaged nerves is what neurotrophic keratitis means. When people have that, they often get worse and worse and worse and worse, despite us throwing everything but the kitchen sink at them. And so, you know, what we've recently come up with is really an amazing new thing. And this amazing new thing is a new medicine called oxervate. And this new medicine called oxervate is something called human monoclonal antibodies. And human monoclonal antibodies are used in just very few medicines across the world because they're very new. And they're actually something that looks at within our body a growth factor, which is a protein that's produced to cause something to grow. And so what they were able to do was they were actually able to clone or make something very similar in a test tube of a growth factor. So they were able to make a protein that looks just like the proteins that we make that grow nerves. And so this is something that's being used in a lot of different things in the body, and they found out that we can easily get these growth factors to get into the cornea. And so I've had patients that have corneal scars, just like the one that you see here, that after using this medicine are now looking just like this. And so what we have here is a situation where patients get severe irritation on their eye, but often don't feel it, and as a result, they have poor vision and don't even really realize why that is. And we look at the front of the eye and we see that they have severe dryness, severe irritation, and one of the things that we do to check their nerves is something called a cotton swab test. And you'll see me doing this more in the office, where I take a cotton swab and I pull it apart and I take it and I wisp it across the cornea. I have a little video of me doing it right here. And so what you saw there was me rubbing the cornea with a little piece of cotton. And you could see that the guy, he didn't blink. Now, if I did that to you, you would say, what did you do that for? And that's because you have nerves in your cornea. In fact, you have more nerves in your cornea than per square millimeter than anywhere else in your body. So now we can test this, and if you don't feel it, we can get you set up with this medicine, get you feeling better right away. Really, really new, cool thing that folds into our love of dry eye here at the office. And we'll talk more about it on another show. I really want to tell you one thing, and that is that if nobody told you they love you today, that I love you and we love you here at Hazleton Eye Specialists. We care about you, and we hope that despite all the craziness and everything going on now, that you enjoyed the last 20 minutes with me and my R2-D2 friend, all my cleaning supplies, and a little bit of eye knowledge. If you have any questions about eyes, need any help, want to televisit, we're happy to provide you that. Give us a call, and we'll see you next time on Eyecare Today.